So, diving into the world of nurse assistants. I gotta say, when I first saw RoleCatcher's guide on the list for today, I was like, okay, yeah, this is important, obviously, healthcare and all. But then I saw the job growth predictions, and I was like, whoa, hold on, there's more to this.
Yeah, definitely. Way more than just numbers, right? There's a huge human side to this. That's what really drew me in.
For sure. And RoleCatcher, they really get that. They actually use the word rewarding to describe it, which, let's be real, you see that everywhere. But I don't know, reading through their guide, the word that stuck with me was impact.
Yeah, because the impact is so direct.
Mm-hmm.
You know, it's not like you're behind a desk all day. You're right there helping with really basic needs, bathing, eating, even just getting dressed. For someone who needs that kind of help, a nurse assistant isn't just like part of the system. They're a lifeline to dignity, independence, all of it.
Yeah, no, you're right. That totally changes how you see the job. I'll be honest, I had this image of, I don't know, bedpans and like taking temperatures, but RoleCatcher paints a way bigger picture.
Totally. They highlight how you're like the eyes and ears for the whole medical team, monitoring vital signs, helping people move around. You're gathering so much info, providing direct care.
Which, it's important to be clear here, you know, you're not the one giving out medicine or making medical calls. Right, it's a vital role, for sure, but there are lines.
Oh, yeah, absolutely. And knowing those lines, that's key to how the whole system works. Like you said, crucial link in the chain, roll catcher, make sure you get that.
Okay, so we've established this is way more than meets the eye, but let's talk about the actual work. Like, RoleCatcher doesn't try to hide it. It's demanding, physically and emotionally.
Oh, yeah, long hours, you're on your feet constantly. Then you add the possibility of getting sick yourself, and it's not a job for everyone, that's for sure.
And that's just the physical part. RoleCatcher doesn't shy away from the emotional toll this work can take either. You're with people at their most vulnerable, and that takes a different kind of strength.
Resilience, empathy, knowing how to talk to people, it's not just like corporate buzzwords. It's survival in this job.
Yeah.
And you're not just dealing with patients. You've got families, doctors, other nurses. Clear communication is everything.
Right, right. So we've got this high-demand job, potentially super stressful, but then RoleCatcher throws a curveball. The job outlook is amazing what gives.
It's all tied to this bigger trend they talk about, patient-centered care. It's this whole new way of thinking about healthcare, more holistic, and nurse assistants are right there on the front lines making it happen.
Can you give an example? Like, what does that actually look like?
Totally. So say you've got a patient recovering from surgery. The old way of doing things, you'd be focused on the charts, the procedures, right?
Right.
But patient-centered care, the nurse assistant is going to take the time to ask, how are you doing? What are you worried about? They're really tuned into the patient as a person, not just a condition.
So you've got all these people needed, right? But then RoleCatcher mentions how many people leave these jobs.
Yeah.
Makes you wonder.
Yeah, it really makes you think, like, what does that say about us? You know, how much do we actually value this kind of care? They don't beat around the bush. These jobs, a lot of times they're underpaid, underappreciated, and they are essential.
Right, exactly. It's like behind all the job titles and the numbers, these are real people doing really tough work.
And that actually connects to another thing RoleCatcher talks about. Becoming a nurse assistant, it's not a dead end. It can be a starting point for a whole career in healthcare.
Okay, so say you are interested. What does that look like, moving up?
So RoleCatcher, they basically lay out two main paths. Becoming an LPN, licensed practical nurse, or going for your RN, registered nurse. Both of those, you'll need more school, more certificates, but you're building on what you learned as a nurse assistant.
They use that phrase continuous learning, and it seems like they really mean it. It's not just like, learn it once and you're good.
Nope, healthcare is always changing. New tech, new procedures, new ways of thinking about patient care. You got to keep up or you get left behind.
Speaking of new ways, what about AI? I mean, RoleCatcher's using it to help people get jobs. How does that even work?
Oh, this is where it gets really cool, especially if you're into tech. Their platform, it reads job descriptions, but like really deeply. Imagine you're not just seeing a list of requirements, you're seeing what's important to that employer, what they're really looking for.
So it's like, I don't know, a cheat sheet to figure out what the hiring manager wants to see.
Kinda, yeah. But it's more than that. It actually suggests stuff to put on your resume, your cover letter. So it's hitting those algorithms a lot of companies use to filter people out.
Like having a digital coach in your corner saying, hey, here's how you actually get noticed. But even with all the tech, some things never change, right? RoleCatcher's big on nailing the interview. They've even got these sample questions, really make you think.
What I liked is they use real situations. Like one question is, how would you prioritize if you've got multiple patients all needing something at once? That's the kind of pressure you'll actually face, so how you answer, it says a lot.
Yeah, it's like you have to prove you can think on your feet and handle the emotional side of those decisions too.
Exactly, and that's where all that stuff we were talking about, empathy, communication, really caring about the patients, it's not optional. It's like the whole game.
Right, like you got to remember these are people, not just, I don't know, medical cases.
Yeah, they've got fears, hopes. You're seeing them at their most vulnerable,
Which kind of circles back to that turnover rate, huh?
for sure, and it makes you think, are we doing enough for the people in these jobs?
Right. It's easy to focus on the skills, the certifications, the job market, all that. But there's something deeper going on here.
It's a question that goes way beyond hospitals.
Yeah.
You know what I mean? It's about how we treat the people we depend on to take care of us as a society.
It's not just about the money, though that's obviously a huge part of it.
Huge, yeah.
It's seeing the emotional part, how demanding this work is, mentally, physically, all of it.
Absolutely. And RoleCatcher, they don't pretend to have all the answers, but they show you what's really going on in a way most people don't see. They give you the knowledge to ask the right questions, you know, push back against assumptions and have these conversations in a way that matters.
So for everyone listening, whether you're thinking about a career change or just wanted to, like, peek behind the curtain a little, what should we take away from all this?
Maybe it's a new appreciation for the people who do this work, the ones most people don't even think about.
The unsung heroes.
Right. Or maybe it makes you want to fight for them, make sure they're getting the support and the recognition they deserve.
Because at the end of the day, no matter what you do, understanding what it takes to be a nurse assistant, the dedication, the resilience, the heart, that changes how you see the world.
Totally. It reminds you there are human stories behind every job, every statistic.
And sometimes all it takes is a deep dive to really hear them.